So I was really nervous and worried about attending my scans because I'd had a miscarriage about 6 months previous to this pregnancy, and that miscarriage I had found out at my scan that it was kind of a miscarriage and that the pregnancy wasn't kind of going to go any further from that point. So I went to that scan by myself, in a mask, and I sat in that hospital waiting room for a long time in the same waiting room that I'd been in 6 months previously, and obviously got the news. And during that scan, I was shaking. I wasn't allowed to phone my husband. I wasn't allowed to kind of video call, anything like that. The rules in the hospital were really strict. And in the scan, I remember the sonographer kind of saying to me, "I'm so sorry, I really wish I could give you a hug. I can see how upset you are, but I'm not allowed to touch you. I'm not allowed to kind of come any closer than I am." And obviously, as soon as I found out the news, that everything looked fine, then I was delighted. But the signal in the hospital was really, really bad, so I still couldn't even get out of that waiting room to phone my husband. So he was just sat in the car park for an undefined amount of time, waiting, not knowing what the news was going to be. During the birth, these staff were fantastic. After the birth, so in the hospital, I'd had some complications after the C-section, so I'd had quite a lot of bleeding afterwards, so I ended up having to stay in recovery for longer than originally planned. After that, so after the kind of visiting hour period, my husband then had to leave, and I was in a substantial amount of pain, which nobody kind of communicated to me, or if they did, I wasn't aware of it because of what had just happened. And I cried for about 45 minutes, and a midwife, one of the care assistants, sat and held my hand for 45 minutes because I was completely inconsolable. She kept coming and checking on me that I was okay, and she was like, "I'm really sorry you're having to go through this." And she was actually the one the next day who pushed my wheelchair back down to the car, and she made a really big difference just to make you feel that you're not going through something alone, or that you're not that what you're feeling is valid, basically. It had a huge impact on my mental health. I think afterwards I really struggled, I think, through what we'd gone through with the miscarriage, and then having the kind of pregnancy effectively alone at a lot of these appointments and these scans, and then going into a C-section, which I didn't feel that I actually wanted. I felt like I had lost a lot of control. I really felt that I struggled to kind of bond with a lot of things, and actually I wanted that control back. And the post-birth side of it, because I was quite physically not able after I'd had my C-section with my daughter, that I really wanted that control back. So actually it fed into a lot of anxiety tendencies and things like that. And I got to a point a few months after the birth of my daughter where I was quite low and I was really struggling, and I did reach out and I did get some therapy because I felt that it wasn't right and I needed to do something about it. A lot of the frustrations with the hospital was it was different trust to trust. So I had some friends that were choosing to go to one hospital because of certain rules, or actually friends that transferred midway through pregnancies because of rules around hospitals, and they were trying to meet their own personal needs as well. The support that your partner or your kind of, I don't know, friend, mum, whoever, is really, really important. And whether that is kind of moral support as the person next to you, or physical support of what they're doing, and just that shouldn't be overlooked, because those things will have a huge impact on the NHS and the services that they can provide too.